Good afternoon, everyone. You are very welcome to the HSE CHO-DNCC Heart Healthy Workplaces webinar. The panel will be delighted to receive any questions you may have. Please use the Q&A feature located at the bottom of your PC or laptop screen. If you are using an iPad, you will find this feature located at the top of your screen. Without further ado, I will now hand you over to your host, Kalina Kerwin, Health Promotion and Improvement Officer. Thank you.
Hi everybody, I hope everybody's doing well today. My name is Kalina Kerwin and I'm a Health Promotion and Improvement Officer here in Dublin North City and County. And I'm absolutely delighted to welcome you to our 6th webinar of our series of webinars in October for staff health and wellbeing. Just to let you know, these webinars are being run in partnership with Human Resources and everybody here in health and wellbeing in DNCC. So today's talk is by Martin Ryan. Martin is from the Irish Heart Foundation, and Martin's going to go through different ways we can try and reduce our risk of developing cardiovascular disease. And we're delighted to have Martin today. But before I hand you over to Martin, I'd just like to quickly remind you of the Q&A feature. If you've any questions for Martin at all, pop them in the Q&A and we'll try and get to those at the end of the webinar. Just one further thing, we are on Twitter and our Twitter handle is @HSECHODNCC. So we'd be delighted if you could tweet about our event today. And our hashtag for our October series of webinars is #StaffHealthDNCC. So without further ado, I'd like to hand you over to Martin.
Thanks, Lena. Thanks for that lovely introduction there. Guys, really, I suppose it's a real pleasure for me to be here today, being able to share this with you. And 1 second, I'll get this up. So hopefully you can all see that. Okay. So as I said, a real pleasure for me to be here today. And really the crux of the talk that I'm going to present you here today is around your heart health and ways in which you can protect your heart health. So I suppose before we really get stuck into the main bit of it, just a little bit about what the Irish Heart Foundation does as an organisation. Really, we're about defending, empowering and caring for all Irish hearts, and ways in which really we can do this. We do it a number of different ways and important ways to the health of this country. And really we spend a lot of time caring for and speaking out for people across all communities in Ireland. We're leading in innovating and health promotion and being able to come up with different ways to connect with as many as those communities as we can possible, and really building a lot of CPR and life training skills as part of that as well. And we do a lot of work around campaigning and advocacy for policies that help to support people in leading healthier lives as well as that. But for today's talk, really the main crux of it will be around cardiovascular disease. And cardiovascular disease really is a term that's used to describe conditions that affect the heart, but also affect blood vessels. And within cardiovascular disease, there's 2 main components really in terms of heart disease, but also stroke. And we'll be mentioning both of them as we go on today as well. And I guess a huge motivation for us as part of our work in the Irish Heart Foundation is around some statistics such as this one here. It says that 80% of deaths caused by cardiovascular disease are preventable through healthy lifestyles. Now, this is really important, I think, when we consider the numbers of people affected by heart disease and stroke every year. It stands at about 9,000 deaths a year. And when we think that 80% of those can be preventable, that's 7,200 lives who could be really saved through healthy lifestyle. So that's why the whole healthy lifestyle piece and healthy living is really, really important in our daily lives. But as well as that, it is, I suppose, vital to know that there are certain risk factors that we cannot do anything about. And really, these are often seen as the non-modifiable risk factors. And these include things such as family history, previous events of heart attacks or strokes, gender plays a part as well, ethnicity and age. So all of these really are the things we cannot control or outside of our control in terms of risks towards heart disease and stroke. But on the flip side of that, and on a different aspect to it, there is a lot of things that we have some control over and that we can change. And really, these are seen as the building blocks towards prevention of cardiovascular disease. So really, it's things around like kickstarting your motivation, looking at management of blood pressure, cholesterol, diabetes, looking at managing your weight in a healthy fashion, looking at quitting smoking, incorporating more physical activity, and looking at how you deal with your stress in your life as well. And we'll be mentioning, going into further detail about these later on as well. But I guess one of the first risk factors towards cardiovascular disease I want to speak about is in relation to nutrition. And really, nutrition is a huge aspect towards our prevention of heart disease and stroke, and it incorporates a number of key elements. So firstly, by incorporating more fruit and veg into our diet is a very nice commodity we can have in bringing down a risk towards cardiovascular disease. Looking at bringing in more heart healthy fats into our diet, that's things like fish or fish oils, nut oils, avocados, real healthy sources of fat. Limiting our salt intake is another huge step we can take in terms of improving our diet as well. And high salt intake has been shown to be associated with high blood pressure scores as well. So it's really important from that point of view alone. Looking at incorporating more whole grains into our diet as well. If you're somebody who eats a lot of bread or spaghetti, pasta, those kind of food sources, there are always whole grain options of those as well. So it's important to note that. And looking at limiting our high sugar, high fatty foods as well. So those are the foods really that are most harmful towards our heart health. And another real big aspect towards the whole intake piece is around alcohol consumption. And I guess the alcohol piece is something I've seen in my previous roles, and it's a common trend that seems to be appearing in research and healthy lifestyles as well. And I guess the important thing to know with alcohol that it turns to sugar in your blood. And really, when we look at a visual description like this, it just gives you a snapshot of the kind of calories and the amount of hard work that's needed to burn off those calories when we consume alcohol. Because unfortunately, with calories, they don't just disappear from our bodies. We have to engage in some kind of physical activity that's going to get rid of those excess calories as well. And the problem with alcohol intake is if it's done in an excess amount or chronically over time, it can lead to very nasty side effects down the line as well that'll really increase our prevalence towards heart disease and stroke. So I think it's about understanding the safe ways in which we can engage in alcohol consumption. And that's looking at things like drinkaware.ie, Alcohol Ireland, ourselves and the Irish Heart Foundation. There's loads of information around what are standard units, measurements of drinks, and what's a safe way to do that on a weekly basis. So there's loads of advice around that. So it is important to be aware of, I think, there's calories involved and the amount of hard work we have to do when we consume alcohol, which is something we often forget about. But I guess understanding too that it is a lot about balance. And you know, there is the old saying, everything in moderation, and it's a very cliche term, but there is a lot of truth to it as well. For most of us, we enjoy consuming, you know, high sugar meals or high fatty foods or engaging in some alcohol consumption now and again, but it's the whole now and again piece that is very important, and we don't consume those foods in excess and on a constant basis as well. So it is about enjoying the foods and drinks that you like to do, but doing them in moderation. And I touched on it briefly at the start, but it is a lot about finding your motivation to change some of your health-related behaviors, because they are so important and they play a vital role in your daily lives. And everyone's motivation to change will be different, and everyone's doing it for different reasons. But just understanding how important those health-related behaviors are to your whole health-related system, but particularly in relation to heart health, they can play a huge role. And if you can engage in more positive health-related behaviors, it can have enormous improvements in terms of reducing your risk towards heart disease and stroke. In terms of blood pressure, it's a significant player when we're talking about cardiovascular disease. And you can see there that high blood pressure is the #1 cause of stroke. And I guess the important thing to know about blood pressure is that in recent times, some of those blood pressure categories have changed slightly. So for example, if you were somebody who was within the 120 to 129 systolic blood pressure category before, that would be considered normal. Now, as it stands, you're considered elevated blood pressure recording as well. So it's important to know that the categories have shifted a little bit. And when it comes to managing your blood pressure and looking at ways and how we can really negate its negative impacts in terms of our heart health, there are certain risk factors towards blood pressure that we cannot control. And similar to the whole healthy lifestyle behavior, again, we can control some aspects in relation to our healthy living. And that's stuff like quitting smoking, incorporating more physical activity, looking at safe alcohol intake, salt intake. I spoke about that already, how that can be really connected to high blood pressure. Knowing the importance of caring for yourself is another huge aspect towards the management of blood pressure, and looking at healthy weight as well. And it also brings into account making sure that you're getting regular blood pressure checks and adhering to any medication that you may be on for blood pressure as well. So all these things we can really have some control over, and we can do these things to help us manage our blood pressure in a more healthy and safer way. When we talk about cholesterol, then cholesterol really is a type of fat that's found in the blood, and there are good and bad cholesterol, and you do need both for normal cell function. The problem is if your cholesterol levels get to too high or in excess amounts, you have a huge amount of plaque buildup on the artery wall, and that can really lead to something what's called atherosclerosis, which is basically a type of heart disease. And what happens with that is blood flow to your heart is slowed down or reduced due to that plaque buildup, and that can really lead to significant increases in terms of your risk towards heart disease and stroke. It is important to know that for heart disease patients and for diabetes patients, your max cholesterol levels should be a little bit lower than that of a healthy person. So you can see there is a bit of a difference. The heart disease and diabetes patients are up there in the right-hand corner in that blue little chart there. And that is the difference between those and healthy person's cholesterol scores as well. So just to be aware of that. And I guess similar to the blood pressure piece, there are a number of things we can have some control over and to help us with our management of our cholesterol levels as well. And that's things like making sure that we're getting our blood glucose levels checked, that we adhere to any medication if you're on that for cholesterol, looking at bringing in more physical activity into your weekly schedule, quitting smoking, making sure you're getting a nutritious diet, and looking at management of our weight as well. And in terms of being active, then physical activity is another huge risk factor towards our development of cardiovascular disease. And I myself, in my role, I'm hugely invested in the whole physical activity piece. And I guess sometimes we lose the importance of and the understanding that there are different types of physical activity. And the three main ones that we have are aerobic, muscle and bone strengthening exercises, and balancing exercises. So really aerobic exercise is anything like walking, jogging, swimming, cycling, anything that works your cardiovascular system. Muscle and bone strengthening exercises really work to improve your strength, but also improve your bone health, which is something that's really important as we go on throughout our later life. And also to go hand in hand with that, balancing exercises also play a huge role in improving our strength and stability, yes, but they also play a huge, massive role in decreasing our risk for falls as well. And we know that fall risk is a huge factor in morbidity levels as we reach 65 years and beyond. So really it's about looking at bringing in all three types of physical activity into our weekly schedule of exercise. And it's very important to understand that. And I guess sometimes we tend to maybe focus a little bit too much on the aerobic exercise side of things. And although that is very important, yes, it will form the main component of our weekly physical activity. It is vital that we don't forget about the muscle strengthening exercise and also the balancing exercises as well. And one thing I think is really interesting is that if you're reaching your recommended levels of physical activity weekly, it only equates to 3% of your day. And that's very, very small in the grand scheme of things. And it just shows that you can fit it in small portions throughout your day. And similarly, some of the more recent research has shown us that even up to 10 minutes at a time can have a real positive effect in terms of improving your physical fitness as well. So if you are someone who says to me, you know, I can't take 30 minutes out of my day, I can't take it all in one go. And that's very normal. You know, like, I mean, most of us have loads of other commitments that we have day to day, and we're getting pulled left, right, and center. But that's no problem not to have that 30 minutes. You can go 10 minutes at a time, maybe a brisk walk before you go to work in the morning or at lunchtime when you come home. Building in simple steps to get some physical activity into your daily life is very, very important. And it is also about doing the things you love. Sometimes we have this perception as well when it comes to exercise that it has to be always really hard and we have to take 30 minutes of hard cycling or hard running just to get exercise into our daily lives. But it doesn't have to be that case. And you can continue to do the things you love and build in physical activity as part of that. Be that gardening. You know, gardening has been shown to elicit very strong benefits in terms of improving our bone health. Walking your dog, you're getting aerobic exercise. Playing with kids or grandkids, you're also getting aerobic exercise. So there's very simple ways in which we can build this into our daily lives, and we'll have massive impacts in terms of reducing our risk towards heart disease and stroke going forward. And when we look at weight management in this country, I guess some of the statistics around overweight and obesity are quite alarming in Ireland, in terms of that 66% of men and 55% of women in adulthood are living with overweight and obesity. And what's maybe more concerning is when we look at our children's risks towards overweight and obesity, we can see that more than 30% of our kids have overweight or obesity. And what we've seen since 2020 is that there's been a 21% increase in levels of overweight and obesity in children. The problem with that is when someone is living with overweight or obesity, your heart has to work a lot harder to pump blood around the body. And this can lead to a lot of wear and tear on blood vessels and on your heart, which can cause very negative effects in terms of your own heart health as well. Now, it is positive to see that our whole stigma and our language around overweight and obesity is changing, and it's changing slowly in this country. We have a lot of work done, but there still is a lot of work to go with our perceptions and that. But I think we're getting more knowledge around how genetics can play a big role and how your environment can really shape your overweight and obesity as well. So as I said, we have come a long way. We still have a long way to go, but understanding still that overweight and obesity is a massive player in terms of increased risk towards cardiovascular disease. When we think about stress, I guess stress on its own can be a major risk factor towards heart disease and stroke. But when we combine someone who's maybe highly stressful with someone who has high blood pressure, is physically inactive, has maybe high cholesterol levels, then you get someone who falls into a very high risk category for development of cardiovascular disease. And we often see that stress will go hand in hand with some of the other heart disease and stroke risk factors. And really, I think when it comes to stress, it's important to look at how your environment shapes your stress, recognizing your own signs of stress and how that will affect your own health, and particularly in relation to your heart health, but also about looking at how you go about beating stress and ways to reduce stress in your life, because it doesn't have to be with you forever. There are ways and means to look at going in and working on that and trying to reduce the stress that will have a positive impact in our lives. And really, we have ourselves in the Irish Heart Foundation have a lot of things online, supports around stress and things like stress busters, which can have huge impacts in terms of reductions of cardiovascular disease risk factors. Smoking is obviously another huge risk factor in development of heart disease and stroke. And again, when we talk about smoking, the statistics read for fairly grim reading, really, in terms of that 1 in 2 smokers will die from smoking related deaths. And if you are a smoker, you are 50% more likely to suffer from a heart attack at some point in your life. And we all know the very dangers that smoking presents, but I guess the cigarette companies and the makers of e-cigarettes and those kind of companies are very good at hiding, not fully disclosing, I guess, the ingredients which are in cigarettes and the harmful effects it can have. So it is very, very important to understand that smoking is a massive contributor towards increased risk of heart disease and stroke. And there is a lot of hope out there, though, for people who are smokers, or if you know someone who is a smoker, there is still loads of ways in which you can help them to quit. And things like quit.ie, who work in conjunction with Healthy Ireland, with yourselves in the HSC, with Irish Heart Foundation, the Irish Cancer Society, there's a lot of great work goes into creating those supportive environments to help people quit, not only just for the short term, but in the long run as well, and to help them on their journey to doing that. So it's important to engage with those. And I would encourage you, or anybody in your life who is a smoker, that anyone in your life who you know is a smoker, to please engage with those different resources that quit.ie would have. And also understanding how socioeconomic status can play a role in our prevalence towards cardiovascular disease. And it's looking at things like our education, income, employment status, and environment, and how all those things can shape our risk factors towards heart disease and stroke. And I guess it's looking at policy changes from the top down that will affect communities, but also looking at the communities themselves and seeing, well, is there examples of, are there options to engage in physical activity? Are there opportunities to do that? Is there a supermarket in the community? Is there medical services in the community? So understanding how those things will really impact on the overall health of the community. And it's not just about, heart health of workplaces. It's also about, if you think of it, you're improving your heart health in your workplace, but you're also improving heart health in your community and bringing that back to your families as well. So it's all very important and evidence-based interventions, which are vitally important for the heart health of everybody across the country. So that's the risk factors towards heart disease and stroke. I'll just go a little bit into our Heart Month campaign, because some of you may have seen this already. It was Her Heart Matters campaign, which is the awareness campaign we ran with for this year's Heart Month. So every year in September, the Irish Heart Foundation runs an awareness campaign based around a different topic in relation to heart health. And this year we chose women's health, in particular menopause and heart health. And some of you may have seen this up on our social media channels. There was a lot of coverage around it. We worked a bit in collaboration with Marks and Spencer supermarkets and with Peter Mark hairdressers as well. So it was a hugely successful campaign, and one in which we were very happy with the positive outcomes in terms of raising awareness around menopause and heart health. And really what we wanted to do was create a range of different resources, supports and tools that help women protect their heart as they enter menopause. And I guess the foundations in what the campaign was built off were around things like 1 in 4 women will die from heart disease or stroke. And really we saw how under-researched, under-diagnosed and under-treated heart health was in women entering menopause. And also to understand how as a woman, your risk of heart disease and stroke increases as you enter menopause. So those are the real key fundamentals of what the campaign was based around. And as part of that, we went in and got real women's stories. Those real lived experiences formed a very, very significant arm to the campaign. And it was, I guess, hugely emotional to hear some of those stories, but also very powerful and inspiring as well. So to be able to hear all those and to read them online or look at them on YouTube was absolutely fantastic to be able to engage with that. And it, as I said, it formed a very strong component of the campaign itself. We also developed a self-care and well-being journal, and this was really to provide a practical tool for women to help them in their day-to-day lives of heart health care. And within the journal, there's things like goal setting and understanding how our barriers and preventers towards achieving good heart health can affect us in our day-to-day lives, and also understanding how habit mapping can really form part of our day-to-day behaviors as well, and overcoming some of the challenges towards good health-related behavior as well. And I think that kind of practical resource is so important because, of course, you can give all the information around, a Heart Month campaign like that, but it is very important to provide a practical tool that will help these women day in, day out in their lives as well. Also, as part of the campaign, we held a webinar that was hugely successful and had a huge range of different speakers on it. And I guess the volumes of people who tuned into that webinar spoke volumes. There was absolutely, I think there was a couple of thousand people who tuned into that webinar, and it's still up available online for us and also on our YouTube channel as well. So if you want to check that out for more information, it's absolutely a brilliant resource. And on the webinar, really, we had people, we like Dr. Deirdre Lundy, we had Alison Keating, who is a psychologist, Orna O'Brien, our own in-house dietitian, and Melanie Enright, who shared that real lived women's experience as well. So it was really powerful to hear all those different experiences and come together and share different insights and different approaches to women's heart health and in particular menopause and heart health. So that was a fantastic component of the campaign. And as I said, still available to see online for you if you want to delve into more detail on that. Then I guess away from the Her Heart Matters campaign, we do have a range of different other resources, supports and tools available to help workplaces to achieve more healthy stations and really to create an ethos of healthy living, which is really important. And I guess some of these resources based around loads of information packs. We've a range of different leaflets and booklets and huge range of resources around that. We also have a lot of different dietary support. So our dietitian would have worked really hard at creating meal recipes and meal ideas that are really easy to follow along to, but are also very nutritious and hugely healthy as well. We also have a mix of different challenges and support lines, and as well as not only the Heart Month campaign for September, but we also have a huge range of other different campaigns that go on throughout the year. For example, we have a childhood obesity campaign that's going to kick off now towards the end of this year. We also have a hypertension awareness campaign that you'll see more of hopefully in the next few years as well. So there's loads of ongoing work on different campaigns to try and connect with as many people as we can across all communities in Ireland. In terms of the challenges then, like there's some really popular stuff that we have online to help workplaces, as I said, to create that ethos of care around healthy living and physical activity. And that's things like couch to 5K groups, understanding how to set up workplace step challenges, move more walking challenges, also things around creating active workplaces and really looking at workplace walking leaders, because I think it's important to create some leaders within the workplace that are going to drive that healthy living going forward. And as I said, it starts, you could look at it as it starts in the workplace for you now with this healthy living initiative, but you can bring that home to your communities and also to your families as well. So there's a huge feed down effect to this. It's not just for yourself, really, it's for others in your life as well to impact them in terms of healthy living. That's just an example of other different resources we have. Escape Your Chair Challenge. Some of you may have come across that in the past. It's another hugely popular resource. There's other things again around how to set up walking groups and different letters to staff involved as well. And I guess the healthy eating resources, I spoke already about the meal plans and meal recipes that are available. But I think another very handy little commodity that I've found very useful even for myself is the Irish Heart Foundation food shopping card. And this is a little card that you can carry around in your wallet or your purse, and you can take it out when you're in the supermarket. And really, it just gives you an idea of the different components, different elements of food that you are buying and therefore consuming in your body, and just lets you see how much maybe sugar you're putting in, or how much protein you're getting, or how much carbohydrates you're getting in certain different foods. So it's very nice to see that, and to have that there when you're picking up those foods is a very nice commodity to have. For the supports, like our own support team and our nursing staff do a fantastic amount of work in promoting these support groups, and we're available every day with those different support groups, and they can be got on our telephone number, on our website, on the support@irishheart.ie email address. But we also have a range of different Facebook support groups, and these have become very popular, and really they create an environment of conversation and supportive network to connect with other people. And the range of different groups we have are things like stroke survivors, carers for stroke survivors. We have heart failure groups. We have a general network for Irish Heart Foundation people who want to get more information around different resources as well. So there's a huge range of different support groups that I would encourage you and to engage with, really, and anyone in your life who you feel that might be applicable to, for them to reach out and engage in those support groups as well. And those different support groups are facilitated by those really highly trained support staff and nursing staff as well. So guys, I guess just a few take-home messages. I don't want to bore you any longer. I've probably bored you too long already. But anyway, just a few take-home points. So first of all, like understanding and seeing the value in that cardiovascular risk factors can contribute to our overall health state. And we've seen they can contribute both positively and negatively. But a lot of the things, the healthy lifestyle pieces, we have a lot of control over them. And it's about, things like building in more physical activity, looking at our diets, making sure we're managing our blood pressure, cholesterol levels, things like that, that can have a real good direct impact on our overall health state and on our heart health state as well. The Her Heart Matters campaign resources that I spoke about already, I would just encourage you to share that with any women in your life who you feel that may be useful for, be that wives, girlfriends, sisters, friends, work colleagues, whatever that may be. Please do share that with them, or even if you want to put them our way and we can share those resources with them for sure, because it is important to connect with as many of those women as we can possible. And also about accessing those supports, tools, resources for workplaces that I was talking about. They're available for you to use, guys. So again, we do encourage you to please reach out and use them to create that environment of healthy living within your workplace. And lastly, and I suppose it's a very important point, is around making small but meaningful changes that will really have a direct impact in terms of improving your heart health and reducing your risk towards heart disease and stroke. And it's not about ripping up the script massively. You don't have to go out this evening and change up your life hugely. It's about putting those small little steps in on a daily basis, those healthier choices that will improve your heart health going on into now and into the future as well. So guys, thank you very, very much. As I said, it was a pleasure to come on today and to be able to share that with you. Hopefully you've taken something from that. And I think we have some time for some questions. I think if Karen or Clean are there, I think we have some time for some questions, guys.
Thanks, Martin. That was really, really, really useful talk. So thank you so much. There were a couple of questions coming through there, if that's okay. If we still have like about 5 minutes. So some of your stats were really, really startling, and it's really good to kind of hear them and remind us. One of the questions that came in from somebody watching the webinar before we logged on today was, can this be incorporated into healthy workplaces as an initiative for HSE teams, or would you have any advice around that?
Yeah, well, it certainly can. And I mean, I suppose there has been a huge ethos in terms of making sure that HSE staff are looked after in terms of their own health and well-being, because I think sometimes you guys are the ones caring for everyone else in the country, and you sometimes neglect your own self-care at times. So it's important to be able to build that in. And there certainly are options to do that. We've started ourselves to work a lot with HSE sites to develop well-being initiatives. And that includes things like, even walking routes within workplaces can have a huge impact, and those little challenges that I was talking about. So those can all be built into a very creative way. That kind of breeds, I suppose, an environment. There's a little bit of a competitive edge within those as well, but it's not all about being competitive. It's just about improving staff health and well-being, but it works in all those different aspects to making sure that people in workplaces live healthier lives. So yeah, it certainly can be built in. Yeah, definitely.
That's brilliant. And so like, just in relation to resources, if they wanted to contact you, that's all on www.irishheart.ie. Would that be correct?
It is indeed. Yeah, it certainly is. So you'll see on our website when you go on, if you look up www.irishheart.ie, and it'll bring you into the homepage, and you just click ways to look after your heart health, and you'll see that'll bring you into like healthy workplaces. So there's loads of different resources within that as well. All those different challenges and information packs that I was speaking about there, they're all within our website as well. Yeah.
Brilliant. Yeah, we did the Escape Your Chair challenge here, and that worked really, really, really well. I'm just going to try and get through some more questions.
Sure, no problem.
Just another point that was made kind of during the webinar was, it was great that you mentioned, the risks of cardiovascular disease when women are going through the menopause. And just, you mentioned a leaflet there. Is that leaflet available on the website as well? It was on heart health and the menopause.
Yes, was that the self and well-being journal, Cliona, you're referring to there, or
was there a specific one on heart health and the menopause?
We do have different leaflets on the on the menopause side of things, but I think the self-care and well-being journal is definitely probably the most powerful resource you have within that, and that is available online. But all those, basically anything in relation to Her Heart Matters is available online on the Irish Heart website, but you can also request to have, like we post out actual hard copies of those different journals and leaflets as well. If people wish to do that, that's no problem as well. We can arrange that.
That's brilliant. And you mentioned kind of the stress element, which everybody experiences stress in their daily lives. So just to make people aware that we do have two talks coming up, one on the employee assistance program, and then we also have Derek coming in from Shine to talk about how to look after your mental health. So just if people want to sign up for these talks, they'll be popped in the chat function there as well. And we'll just take one more question, if that's okay.
Oh, that's fine. Yeah, absolutely.
Somebody was just looking, an interesting question came in about any stats on secondhand smoke, when, if somebody was going out to visit somebody in their home. Is there any stats in relation to, I suppose, heart health and secondhand smoke, and our risks in relation to same?
Off the top of my head, I can't think of any stats in relation to that, but there definitely is a lot of research going into that as well. I know in recent times there has been a lot of studies to look into secondhand smoke, and it's definitely a very important point as well, because you consider a lot of people don't smoke themselves but can be affected by secondhand smoke as well. So I think particularly evident from what I've read around in relation to parents and their kids, that's a big aspect. If you're a parent and is a smoker, it's vitally important that you try as much as you can not to smoke in the same room or the same buildings as your kid, because that can have can feed down into having negative effects on their own health as well. So I think if you can avoid that as best as possible, that'd be probably the best route to go down from what I know about. But in terms of stats, There definitely is, but I'd have to refresh my brain, Cleaner, but there definitely is.
No, that's okay. No, that's absolutely fine. What I might do is maybe get them off you, and then I can send it to anyone that's registered to the talk, if that's okay.
Sure.
If that's okay for the person. So we might wrap up there, if that's okay, Martin. Thank you so much again. It was really, really good talk today. So thank you so much. Before everyone heads off back to their jobs, I'd just like to remind you of our next talk, which will be this Thursday, the 20th of October, and it's with the Employee Assistance Programme. You can see it there. It should come up for you now. It's with Ray Maloney. So this is an excellent talk. If you want to sign up, you just have to scan the QR code there, or you can always email us on hwb.dncc@hse.ie. So after today's talk, you'll also be getting a link to the survey just to evaluate today's talk. If you wouldn't mind completing that, you're in with a chance to win a prize of €50 one for all voucher. So please complete the survey, because it'll help us inform for future staff health and wellbeing events. I'd also just like to quickly remind you of our Twitter handle is @HSE_CHO_DNCC, and our hashtag is #StaffHealthDNCC. So that's it for today. So thank you, everyone. Have a good day.